There is a laboratory test many Nigerians still do whenever they have fever. In fact, in many places, once someone complains of fever, they are quickly told, go and do a wider test for typhoid. But diagnosing typhoid fever with the wider method is actually outdated. And as a medical laboratory scientist, this is something I see very often, still practiced by my colleagues. If you watch to the end of this video, I will explain why the wider test can sometimes be misleading, and I'll be recommending what the more reliable test your doctor or healthcare provider may use when it comes to typhoid diagnosis. But for those seeing me for the first time, hi, I'm Dr. Amy Thompson, a medical laboratory scientist practicing in Nigeria. I help simplify lab tests and health information for everyday people so that we can understand our lab results and make better informed health decisions. The wider test was actually developed more than 100 years ago to help detect typhoid fever. The test can sometimes be positive even when someone does not have typhoid. It may also react with other infections such as malaria and other bacterial infections. And in places like Nigeria where typhoid fever is common, some people already have the antibodies as a result of past infection, which can make their test appear positive even when they have no current infection whenever you are doing the test. And because of these issues, relying on the wider test can sometimes lead to misdiagnosis and unnecessary antibiotics use. So you will ask me, Amy, what test is more reliable when it comes to typhoid diagnosis? When typhoid fever is strongly suspected, your doctor or healthcare provider may recommend a blood culture or stool culture test. As for me, in the lab I practice, we no more do this particular wider test. If it is requested, we usually call and suggest the alternative to the doctors. The blood or stool culture test helps detect the actual bacterial infection causing the typhoid. But before I end, let me ask this question. Have you recently done a wider test? You can leave the answer in the comment section. While if you're a scientist following me, do you still do this wider test in the laboratory? If you do, let me hear why you're still doing it. See you next time. Bye.